Thank you very much. Good afternoon, everybody. And I've used the phrase before in different contexts, but this is very much a hallelujah day because today is extremely significant. It's one I've been looking forward to. Wasn't sure exactly when it would arrive, when I became chair of the Civil Contingency Authority in mid-October 2020, some 15 or 16 months ago. But today we can announce that from the very first second of Thursday, the 17th of February, the emergency regulations in place around COVID-19 will lapse, and the Civil Contingency Authority has decided not to renew or replace them. Now, we've made this decision, we made it yesterday, which means that our management of COVID will no longer be under the emergency powers of the civil contingency legislation. In practical terms, that means the legal requirement for positive cases to self-isolate falls away, but we're going to ask people, and Dr. Brink and I will speak more about that in due course, to be vigilant, to be responsible, and to be sensible. And also, border restrictions will be completely lifted again from the same time. We believe that the decisions that we've made in that regard are proportionate, because we can only act if our measures are self-imposed regulations, which we then have to bring through the states by way of emergency regulations, are made if it is proportionate and if there is an absolute necessity so to do, and there isn't that necessity. Now, why are we able to make that decision? We're able to make that decision for various reasons. One is the very, very good sense of the overwhelming majority of the people of this bailiwick, which shows just how responsible people are and how well they've reacted to the significant challenges over the past 2 years. And the other, and it's part and parcel of the first, is because of the very high take-up of our very, very successful vaccination program. I again urge those that haven't been vaccinated, that can be vaccinated, to get vaccinated. It's not too late so to do. Of course, so we're returning to some kind of normality, in fact, a large degree of normality. Now, what we've also got very strong evidence is that following the recent Omicron wave, that critical services across the bailiwick can meet the challenges that have been imposed upon them. So this really is a good news day, and as I say, a testament to the responsible actions of so many people in the bailiwick. But there's always a but, isn't there? But it is a soft but, and it's nevertheless an important one. We cannot, as a community, give up and lose all the advantages and the sacrifices that people have made over the last 2 years. So everybody who is ill, who people will fall ill, stay at home. If you're unwell, just simply stay at home. And even though as from the 17th of February, the automatic isolation or the legal isolation restrictions will lapse, we're still asking people to self-isolate if they get COVID, if they are positive for COVID. So there's still a very sensible role for us all to play. We've all got to be responsible. Now, as Dr. Brink has so ably advised many times throughout the pandemic, no decision is risk-free. And thus, while the CCA has decided that now it's the right time to stop using emergency regulations, we want that to remain the case. I don't want to be back here in a month's time, 3 months' time, 6 months' time saying we've got to impose this, that or that regulation. But we can only do that, amongst other things, and particularly amongst other things, if people are sensible. Wash your hands, do all the things that you should be doing, and respect others. If people still want to wear masks, respect that. That's their judgment, that's their right, and they're perfectly able to so do. Now, Dr. Brink will go through the latest data, provide further expectations of how we're going to manage the impact of the virus, which isn't going to go away. It's going to be here tomorrow, next week, and next year, but we can deal with that outside of the emergency. And we'll listen, as we have so often, and I'm so grateful. I've had so many meetings with her over the last 15 or 16 months, I'm going to miss seeing her so regularly. But she will tell us how we can move forward successfully without having to have all these horrible rules and regulations. But I do want to cover just some of the highlights in terms of how we will manage COVID post the 16th and from the 17th of February. Free packs of lateral flow tests will continue to be available for anyone who wants to use them, with positive tests able to be reported through the current online platform or by calling the COVID helpline. Confirmatory PCR tests will also continue to be available. Now, positive case will be asked to notify contacts within 7 days of their lateral flow tests advised for contacts, and public health will no longer carry out routine contact tracing. We're also going to publish COVID figures on the website weekly instead of daily. With the removal of the border restrictions, arrivals in the bailiwick will no longer be will need to use their travel tracker and complete it. We don't want to compete with anybody. But the travel tracker will remain active, and so you should feel able to use it to demonstrate what your vaccination status when you're travelling outside of the bailiwick, because you will be asked. I mean, I was listening to the radio and watching the TV today. There are still so many other jurisdictions that will have restrictions going forward, and if you want to travel to those jurisdictions, you're going to have to respect their requirements, because they are requirements, they're not voluntary. Our colleagues in education have advised us that the current use of lateral flow tests as part of surveillance testing for both students and staff will continue until half term. Following half term, all staff and students are asked to undertake a lateral flow test on the first 3 days of the new half term. After that, there will be no surveillance testing for primary school children. Surveillance testing for secondary and post-16 students and all staff will reduce from the current levels to a request that they take LFTs on Tuesdays and Thursdays each week. So I hope we've reached a defining moment. Another sign of normality, as I say, is that the Vaccination Center, and it's been such a splendid facility for us over the last 12 months or so, will be able to be vacated. The St John Loveridge Hall will be able to be vacated by the end of March, so that normal sporting activities will be able to resume from that facility from early April. We thank the sporting community. Well, most people in Guernsey are sporting. I'm not one, but most of the others are. We thank the sporting community for their forbearance during the last 12 months or so. I sincerely, and I emphasise that word, hope that we can look forwards and there will never be a need again for the CCA to use its emergency powers re-COVID. But, as I said earlier, to give us the best chance possible, it's important that everybody heeds the advice from public health, which is both current and will continue. And again, I emphasise, if you are ill, stay at home. If you've got a sniffle, stay at home. Now, everybody, whether it's family, friends, colleagues or employers, has a role to play in the new norm. But enough from me, and over to Dr. Brink for her last set of slides.
Thank you very much. And it really is a milestone day for us, and we're looking forward to the future with optimism. As we've always said, nothing is risk-free, but we're in a really good place, and it's thanks to the community engagement that we've had during the course of this pandemic that has got us to where we are today. What I'm going to do is take you through a trip through our COVID journey, and I know that you've seen this slide before, but what it does is tells you, and we've got 6 stages of the pandemic in the bailiwick, and if we start off to the left of the slide, in stage 1, that was wave 1 of infection. That was, of course, caused by the original wild-type SARS-CoV virus. And during that wave of infection, we had a total of 252 cases, and the peak was 161. But sadly, during that first wave, when none of our population were vaccinated, we had 16 deaths. And that was a very distressing time for all of us. We went into lockdown at the first wave of infection, and after the first wave of infection, and indeed for a prolonged period of time, other than a small outbreak in the November of 2020, we remained essentially virus-free. And other than border restrictions, the life in the bailiwick went on as normal. In January of 2021, we had our second wave of infection, and from there we went into our second lockdown. That, of course, was caused by the Alpha variant of concern. And what you see in that wave, it was much bigger than the first wave, so we had 511 cases with a peak of 368 infections. And during that wave of infection, we had another death. We went into lockdown, and then after the second wave of infection, again, we had a period of very little viral activity. Most of those were related to incoming infections into the bailiwick. And we had 43 cases, and during that time, we had a further death. In July, by the time we reached July 2021, most of our population had been vaccinated. The eligible population had been vaccinated against COVID-19. So we then proceeded, as per our plan, the bailiwick blueprint, to open the borders. And so we had a measured opening of the borders, and that was seen. We did see an increase in the number of cases, and indeed we went into a Delta wave of infection. Now we know that Delta was more transmissible and indeed more virulent, and what we saw during the Delta wave of infections is a total of just over 4,300 cases of infection, and we saw 7 deaths during that time. our Delta wave, we came off our Delta wave in January, in December, January, and we then went into an Omicron wave of infection. And that was by far our largest wave of infection. That's indicated in stage 6 of the bailiwick journey, right on the right-hand side of the graph. And what you saw there was just over 7,100 infections, but a far bigger peak of over 2,400, and a further 6 deaths occurred during that Omicron wave. Now, when we hit the Omicron wave of infection, we had a large number of cases, but what we saw was a dissociation of the number of cases with our hospitalizations and our deaths, and that was extremely important for us. By then, our population was largely vaccinated, and indeed a significant proportion of people were also boosted as well. And that helped us see that dissociation between cases and symptomatic infections and indeed severe disease. Now, COVID is not over. COVID will be with us for some time to come, but we feel we're at a time when it's right and proportionate to progress beyond our legislative framework to manage the infection, and I'll discuss that in a little bit more detail now. But key to our progression has and always has been is our vaccination program. And this is a very busy slide, and I've included it because I thought you might all be interested in this data. But I think what's important is that we've delivered just under 147,000 doses of vaccine in the bailiwick. Now that's a phenomenal effort for a small population. And it's really been that community spirit. We've set up the community vaccination center, we've worked with primary care, we've worked with specialist nurses, and everyone together has enabled us to deliver what is the largest vaccination program in the bailiwick's history. But if you then look at a few of the key elements here, and I'm just going to point out a few things, is to the right of the graph in the top row, what you will see, if you look at all ages, 79% of our population have had 2 doses of vaccine. That's across all ages. If you hone that down to our adult population, 18 years and over, 95% of the population are double vaccinated. And if you go on to the 50 and over, you're looking at 99% of the population being double vaccinated. Now, those are incredible figures. And if you then go to our 16 and 17-year-olds, we know that 65% of our 16 and 17-year-olds have had 2 doses of vaccine. Now, with the emergence of the Omicron variant of concern, it became really apparent to us that the booster program was going to be very important. And as we went into or detected Omicron on the island, first of all on the 9th of December last year, we realized that we had to accelerate our boosting program to ensure that we got as much protection as we could against the Omicron wave of infection. And once again, the community responded magnificently, coming forward to be boosted, but also our call for people to come and help in the vaccination program. We had people, doctors, nurses, members of the community come forward to help get people into the vaccination centre, monitor them while they're in the vaccination centre, deliver the vaccine, help people with mobility issues. It was a magnificent community response, and I think the bailiwick can be justifiably proud of that. So, moving forward, what we want to do is we want to move away from legislation to where all of our measures are by recommendation, advisory, and with community engagement. So essentially what we're doing is giving the community back control over what we do on COVID-19. And I believe that the bailiwick can do this, and we can do this in partnership together. And so we trust islanders, we think they will all do the right thing, and we think they're ready to take back control and move forward to managing the pandemic in a different way. And when we were considering what parameters would we be looking at to make it appropriate for us to move forward, we sat down as a team and we thought, what is making it appropriate to move forward now? The first thing is that we do still have cases of Omicron in the island. We see We saw around 100 cases yesterday. So the cases are still high, but they're holding steady. And we do have that dissociation between cases and hospitalizations. And as of yesterday, the cases that were in hospital were not in hospital because of COVID. They just happened to have COVID and were in hospital for other reasons. Now, the second thing is the vaccination program is effective. And indeed, on the island, we've had exceptional uptake of the vaccination program. Our hospital is not overwhelmed. Our medical director is quite happy that the hospital can cope. Now, the other aspects that we're developing are community treatment programs for people with COVID-19 who are at risk of severe disease for treatment within the community. Our testing is available, so we've got our lateral flow testing, we've got our PCR testing, and of course we've also got our sequencing to detect variants of concern. And what we do at the moment with variants of concern, we take a selection of random samples and we sequence them on a weekly basis, so we're aware what lineage of virus we have circulating on the island. And that enables us to make informed decision making. Now, to me, one of the key aspects of moving forward was the incredible community engagement that we've had during the course of this pandemic. People have engaged, they've worked together, and I think that has been so important. And so all of those are so important as we move forward. And of course, we need to remain resilient, and so we have built up a structure where we will be able to manage future waves of infection. So all of those have been important for us as we look at moving forward. So I think there's sort of like three aspects of our new normal when we look at moving from legislation. As Deputy Fairbrash said, is that we've got no mandatory self-isolation for either cases or contacts. And critically, we're not going to differentiate between vaccinated and unvaccinated contacts of cases. And I think we're at the stage with a highly vaccinated population that it is appropriate for us to move forward in this way. We're also going to have no border restrictions, including no border restrictions for unvaccinated individuals. And what we want is for people to be empowered to make their own decisions, their own health choices, and work together to keep our island safe. So I'm just going to focus now on a few very key issues of living with COVID and how we manage the cases and contacts. So for cases, there will be no legal requirement for cases to isolate. We will be asking people to self-isolate if they test positive, and once they test negative, which we'd recommend first of all testing on day 5, they can self-release if they test negative on day 5 and again 24 hours later. And we've simplified the symptoms, so as long as they don't have a high temperature. If someone has a high temperature, they've probably got an ongoing infection, so we need to be cautious there. So absolutely no legal requirement. And again, for contact management, there'll be no legal requirement for the isolation of contacts of cases, but we will be asking cases to inform their contacts, and that will allow everyone to make informed decisions for themselves. And I think that's really important with the community taking responsibility. We know that transmission for household contacts is particularly efficient. So what we're asking household contacts, or what we're recommending that household contacts do, is to take 7 days of lateral flow testing. And that just reflects the fact that we see a lot of transmission within a household setting. Now, of course, there are areas in our workplace that might be more vulnerable, and health and care facilities, care and residential homes, and so people might have workplace-specific guidance. So if you're a case or a contact of a case, we would be recommending that you discuss that with your employer to make sure that you're compliant with any guidance that they have. And as for the border requirements, the same advice applies to vaccinated and unvaccinated individuals. So that's our cases and contacts. If we then move on to what community measures. Now, we need to be absolutely cognizant of the fact that COVID is not over, that we will still see cases of COVID, and we need to look at how we can manage these cases. So the community measures that are going to be central to that is the continuation of the vaccination and booster program. Now, I think we will have another round of boosting, possibly towards the end of this year. But that's something that we'll have to wait and see what is recommended. The continued availability of lateral flow device tests and PCR tests, certainly up to the end of March, but this is going to be something that we will reassess and modify as more evidence becomes available. And remembering the good lessons of COVID, so the promotion of good ventilation, so have the windows open, think of clean air, think of fresh air. So those things are so important in preventing infection, not only with COVID, but with all respiratory tract infections. Now, the other thing is that we've done very well is respecting people's personal space. So if you're in a queue, give people personal space. As Deputy Fairbrush said, staying at home, if you have symptoms and seeking testing, the respiratory etiquette, catch a bin, kill it, good hand hygiene. And something I really want to emphasize is be kind to each other, respect each other. So some people will be sitting and saying, well, I'm really nervous about the lifting of all of these restrictions. And what I would say to people is if someone feels more comfortable wearing a mask in a closed, poorly ventilated space, we must empower them to do that. We must respect their choice. And so we need to respect choice and be kind to each other. And I think those are all the community measures that are so important for us to move forward safely. So we are looking at staying resilient and prepared. I think all of you know me well enough by now to know that I like to look as much as we can forward and look at what we might need. So we will be looking to keeping a testing capacity for COVID-19 on the island, extremely important. We will be doing things like checking our PPE reserves, to making sure that if anything comes up in the future, we're able to cope with it. We will be ensuring that we can respond to anything. So at the moment, the piece of work we're doing in public health is how would we respond to a wave of 1,000, whatever, and what the appropriate response will be. So as always, we'll be looking forward. And of course, the emergency legislation, regulations can be invoked again by the CCA. We're hoping that any future waves of infection will manage through community engagement, and we won't require any legislation. So I wanted to finish off by thanking the community, and I think the community has been exceptional. It's been an absolute privilege to work with islanders through the course of this pandemic, but also to my own team, the public health team, who have worked all the hours they can to help us get us through, to get us to the stage we're at, and to Deputy Fairbrush for his ongoing support. But there is one person that I think I would specifically like to thank, and that's my line manager, Mark Degare. We simply would not have got through this without you, Mark. You've been absolutely exceptional. You've been with us every step of the way, and the public health team and myself are incredibly grateful for your ongoing support. Thank you very much.
Well, thank you, Dr. Brink. Take heed of Dr. Brink's words, please, because we only want to move forward. We don't want to come backwards. We don't want to. There is a possibility that we would have to reconvene and make regulations. We just simply do not want to do that, and we don't believe that it will be necessary if the community heeds the warnings, heeds the concerns, do all the things that don't cost you anything to do, but are sensible. So let's move forwards. There are just two thank yous I want to say. There are so many thank yous I could say in relation to so many people. And if I don't mention you, it's not because I don't value your contributions. It's just there are two specific people I want to mention. One of my colleagues, Deputy Salisbury, is the only political member to have been with the Civil Contingency Authority throughout the near 2 years that it's been running with this dispute. She was originally there as an automatic member as President of the Health Committee, and since I became Chair of the Civil Contingency Authority, she's been there at my request as an advisor. We couldn't have managed politically without her advice. She's given continuity, she's given her wisdom, she's given her considerable experience. She stepped down yesterday as an advisor because she knew the decisions we'd made. I know she supports them, and I'm extremely grateful to her, both on behalf of all my colleagues, but also myself personally, for his contribution. And the second person is Dr. Brink. Dr. Brink has appeared at every one of these broadcasts, every one of these meetings. He's the only person so to do. And we're very fortunate. I'm a Spurs supporter, and we're very fortunate to have had Harry Kane now and Jimmy Greaves before, who scored lots of goals, and they were our star players. Dr. Brink is our star player, and thank you very much. Now, the Just before I pass over to the media to ask questions, can I just say this? I was a very bookish boy, and one of my heroes was Sir Winston Churchill. And Sir Winston Churchill was said at a certain point in the Second World War, when they were talking about, well, we're on the way now, he said it's not the beginning of the end, it's the end of the beginning. And that's where we are with COVID. We've completed the first chapter, but if we want to write a successful second chapter in relation to COVID, we've all got to act responsibly. People are human beings, so they'll have their failings and their foibles. We've all got those. But if we want our magnificent community, because that's what we are, we're so lucky to live in this community, to be able to live with the freedoms that we should enjoy, we need everybody to act responsibly. Now I'm sure we'll get responsible questions from the media, and I turn over to them and ask who's going to stick their hand up first and ask a question. Yes, Matthew.
Matthew Leach, the Daily Express. This is a question about the vaccination program I'm quite interested in. Will the continued booster program focus on the entire population still, or will it tighten its focus, much like the flu jabs, on the vulnerable and elderly?
Thank you. It's a great question, and the answer is we simply don't know at this stage, and it depends what rolls out over the next year and how things play out. We also don't know whether it's going to be a single SARS-CoV virus, or indeed two different types, whether we're going to look at two different lineages, a bit like the flu vaccine. You have more than one lineage in the flu vaccine. So the answer is we don't know. It'll depend how things play out over the course of this year. We intend to continue following JCVI advice. We've engaged with them from the beginning, and it'll depend what the advice is forthcoming, but also depend on what happens over the course of this year with the virus.
Okay. Any other questions? Yes, John.
John Fernandez, BBC Guide. It's a bit of a technical one. Will masks still be enforced on flights, or is it a matter for the individual airlines? And obviously, Aurigny is a state-owned airline, but perhaps it's one for them.
It is one for them. I went to Jersey to talk about a boat, amongst other things, on Monday to see our Jersey colleagues, and we were required, and quite rightly so, by Blue Island to wear a mask. It'll be a matter for the airline.
Helen Bowditch from the Guernsey Press. Can I just clarify something? So if I arrived at the airport or the harbour from the 17th of February, there would be absolutely nothing I would have to do. It doesn't matter if I'm coming from America,
Yep.
Africa, anywhere. I don't have to do anything.
Indeed, that's exactly the case. Yes, Rena.
Serena Sandy from ITV Channel. So from the 17th of February, you'll be the first place in the British Isles where it will no longer be legally required to self-isolate if you test positive.
Yep.
What reassurances, I think, can you give to those vulnerable islanders that may be saying this is a step sort of too soon?
Well, I think you can never give a guarantee in life, but it's the point Dr. Brink made. Respect people. People who are vulnerable and who are concerned, and there is an element of the community that probably hearing the decision that we've announced in the last few minutes will be concerned. We're saying to them, you don't need to be. You can live your lives as you want them to live, and we will. I believe not everybody's going to be perfect. Not everybody's going to obey the rules that aren't now written in statute, but are written in common sense and decency. But we think that because of the nature of our community, that most people will act sensibly and do all the things and many more that Dr. Brink has advised. Anything you want to add?
Yeah, I think what we need to do is be cognizant of the fact that we're not saying throw all the precautions out. We're keeping respiratory hand hygiene, respiratory etiquette. We're saying to people, wear a mask if you feel comfortable with wearing one. Also, we're using our testing capacity. So if you're visiting a vulnerable person, lateral flow test before you go and visit that person. So we're thinking in the round, and so we're trying to balance the rights of individuals across the spectrum. But I think also we need to respect each other, and what I don't want, I'll be very disappointed in hearing if someone chose to do something, they shouldn't be criticised by anyone else. We must respect and empower people to make those choices, and that includes making choices to protect themselves.
Thank you. Serena again.
It's time to say you're urging people who are ill to stay at home, but the reality is that there are people who probably won't follow that advice now that there's not going to be any fines for doing so. So there are people who say you could bump into in a supermarket who may then already have tested positive for COVID. So how can you manage that to make sure that there won't be another outbreak?
I think it's just a common sense. I mean, if the community does act irresponsibly, and I don't believe that they will, but there will be some. You're right. I mean, it's, you know, saints are in heaven; they're not on earth. There will be people that will break the rules in the sense, although they're not written in statute. We can see it's a matter of balance and judgment. We want to move forward positively, and overwhelmingly, not completely, not 100%, our community's acted responsibly. Is there anything again you want to add, Dr.
Yeah, well, with the lateral flow testing, people would test on lateral flow and then notify us of the result. So we've managed the Omicron wave certainly with public engagement and trust. And again, our community has done the right thing. And I believe there is a social investment in our community. And I think a lot of people don't want to put other people at risk. And I think that's really important. And it's trusting our community to do the right thing.
Matthew?
Following on from the line that we're the first in the British Isles to relax in this way, is the UK government already aware of us taking this step? What kind of conversations?
There have been conversations between us and them, and I think they're taking. Somebody showed me that they're relaxing their restrictions from the end of the month, so they're only going to be 11 or 12 days behind us. It's not a competition. We're doing what we believe is in the best interests of our community. But yes, our external relations advisors and team have been in touch with the UK, the equivalent of the UK. They know what we were intending to do, subject to the decision we made yesterday, today.
Another quite technical one. You said about publishing COVID stats weekly. Is that going to start from the 17th, and what day are they going to be published on? Just so people are aware if they're not refreshing a page for the next few days.
Dr. Brigg, good day.
So we're planning to publish them on Monday or Tuesday. We just need to look at what the most accurate day is, because there's always a lag from over the weekend. So we plan to do that from the 17th. And I think this is in line with us moving away from that daily reporting. And I think you and I have had quite a few conversations on this. And when do you know, how much data is the right amount of data? And I think to stop publishing information altogether, I think people would be concerned about that, because they do want some data. But we felt that going to weekly in the first instance was a nice balance. So Monday or Tuesday, but to be confirmed. The health intelligence team just need to look at when they think they'll be able to provide the most accurate snapshot with regard to the week.
Any other questions, Matthew?
Will this be the last briefing, or will we see you again?
Well, you can always see us again walking around the street. Dr. Brink's very busy, so she'll be in the hospital and doing other things. We don't expect to have another briefing along these lines. There's not one fixed. That can change. But this is not quite the end of sect. It's not the end of the cycle, as it were. But we're moving away now. We don't think... What I said previously on various occasions is we'd only meet when we had something to say. I don't think we're going to have... Hopefully we're not going to have to say much going forward, or not much adverse anyway.
Just one final question from me. What are we going to do, and this may be a question for Dr. Raby, so apologise for this, but what are we going to do to prevent outbreaks like we saw on Giffard Ward last week? Obviously, it was only 6 people who caught it, but it must have been of slight concern, I'm guessing.
Yes.
Yeah. So again, we are going to see outbreaks of COVID, possibly in the hospital, but also in other areas. We might see outbreaks in schools, we might see outbreaks in care homes. So the reality is that COVID is here, and we will see outbreaks. So what we will do is we'll manage the outbreaks, and we'll do it with isolation, with testing, and exactly how we'd manage any outbreak of an infectious disease. We will also look at any outbreak, as we do, to see if there are any lessons learned as to whether we could have done anything to prevent it. So we'll manage them as standard outbreaks. But I think we need to be very realistic, is that we are going to see outbreaks. We possibly are going to see another wave of infection towards the end of the year, towards summer, autumn.
Thank you. Helen, I think you had your hand up.
Yeah, if there was a bad outbreak in another country like France, for example, would you then bring back border restrictions for specific countries?
Well, we'd look at it. I mean, but again, we're looking at what we can do here, because people will be travelling from France in hopefully significant numbers in the summer, and members of our community will be going to France too. You can never say never, but I doubt that we would have to take any active, positive action, in the sense of, when I say positive, I mean bringing in regulations. Again, is there anything you want to add?
No, I mean, I think the only exception there is if a totally new virus
Yeah.
appeared for which the vaccine had
Doesn't
no
work.
efficacy. So we're not talking about reduction in efficacy. For example, what we saw with Omicron, we're talking about a virus evading, a vaccine evading virus appearing. And then we would have to look very carefully at that. But what we want to really focus on is we feel that during the pandemic, we've now set up a very comprehensive set of tools to manage COVID. And we'd like to use those tools to manage COVID rather than relying on legislation. But as Deputy Fairbrash said, we can never say never. But the example I gave you would be one example that would make us have a very close look at it.
Matthew.
A question for Dr. Brink. It's my understanding that viruses often mutate into less dangerous variants the longer they're in the community. Is this true, and is this what's happening with COVID?
No. In a short, well, it's a mixed picture. So the original wild-type virus was less virulent than Delta, than Alpha, the first variant of concern, and Delta, whereas Omicron is less virulent. So by and large, we can, the natural evolution, it would be nice to think that it would go to a less virulent virus, and it is possible that will occur. But it's a complex picture, because not only are you looking at the evolution of viruses, what the population is now building up through both natural infection and immunity, natural infection and vaccination, is a population-based immunity. So it's like seasonal flu. We have that baseline immunity as a population against the virus. So it's a more complex picture. But if you look at SARS-CoV-2, is the wild-type virus, as I said, was less virulent than Alpha and Delta, but Omicron is less virulent than Delta and Alpha. So it's gone to less virulent to more virulent to a less virulent virus. The new BA2 that we've seen, which has been detected and is now designated variant under investigation, that it does appear to be slightly more transmissible than Omicron, but there's no data suggesting that it's more virulent. So I think it's impossible to predict with certainty, is what I'm saying to you.
Anybody else any other questions? Yes.
I'm picking up obvious vibes of relief from the two of you today, and I just wondered if you could tell us a little bit more about, because you've lived this now for months and months, and how it feels on a personal level to be making this big shift.
I think it's fantastic. But again, as I emphasised, we haven't won. There's still a war out there. The virus is still there. It's still going to be there for some time, as Dr. Brink has said. It's just that we can, after nearly 2 years, we can move to a greater degree of normality. We've mentioned in relation to somebody else's question about what the UK are going to do in 10 or 12 days after us. Jersey, Isle of Man, or I think that the level of travel is going the same way. It'll be some time, and I think before other jurisdictions further afield have reached that, but they will reach it, because human beings have to live. We're social creatures. We want to meet, we want to travel, we want to live our lives. It's a great relief, but we can't say that we've won a battle. We've won a war. We just won a battle. Dr. Brink.
So for me, it's cautious relief. So I'm relieved, but I'm cautious, in that we need to see how the rest of this year plays out. We're in a good situation, but it's also optimism, and I'm really hopeful for the future, and enthusiasm to get back to other public health initiatives that, to be quite frank, we've neglected over the last 2 years. So we really want to be talking to you about teenage pregnancy and alcohol harm reduction and other parts of public health, vaccination other than COVID. So it'd be really good to focus on those other programs and really try and push those forward. And I think the engagement that we've had from the community has been great. So we're hoping to use some of that to work as a community in some of our other programs.
Okay. I think somebody else had their hand up. Nobody else? No? Well then, thank you very much. Thank the media for all your contributions and your questions over the last 21, 22, 23 months, whatever it may be. Thank you very much for that. That has been, it's been balanced, sensible, and yet inquisitorial reporting, and that's what your job is for, and you've done it very well most of the time. But thank you very much, and everybody going forward, let's look forward. We live in, as I say, we live in a splendid group of islands, and let's enjoy the spring and the summer. Thank you very much, everybody.
So that brings us to the end of today's briefing from the Civil Contingencies Authority. You just heard there from the Chair of the Authority, Deputy Peter Fairbrash, the headlines on laws around isolation are set to end next week. Emergency powers are over. I have a message from